Hi there, Dr. Ibe, once again, your platform medical advisor. Someone asked me an interesting question if one can get this COVID 19 twice. Before we answer this question, it is not a yes or no answer indeed, but we need to explain one or two things here. Now, I've mentioned severally that this is a new virus. It's still trending. We are still learning a lot about this virus, and so there's still much more we don't know about this virus. But I equally mentioned to us that you can have this COVID 19 without symptoms. The fact that you don't have any cough, no sore throats, no loss of sense of smell, or aching all over does not mean that you don't have the COVID. The only way to know this is by being tested. Okay? Personally, I've had patients who tested positive without the symptoms. Then, after some weeks, they became unwell and, like temperature, sore throats. And when they went back, they equally tested positive, which basically means that the virus had been there in them for a while without symptoms, then developed symptoms in them. So they tested positive. I've equally had patients who had the virus, had mild symptoms, got well, then become seriously a bit more unwell, and went back and tested positive again. And yes, obviously, if you have the virus, you develop some sort of antibodies, but we don't know how long that these antibodies would protect you, if it's weeks or months. We don't know yet because this virus is still trending. We're still learning a lot about it. Bottom line is, it depends on your immune response, on how you develop this immunity, on how it is, how it can cover you. And it depends on other underlying medical conditions as well. So we have to be very careful here. The main thing is to be very, very careful, be cautious, protect yourselves, stick to the advice given to you, wearing your mask, washing your hands, and keeping your social distancing. Okay, even with the normal flu that we have every year we still give our patients, the vulnerables over 65s, those with serious underlying conditions, we still give them the flu jab every year. We cannot say that last year they had the flu jab, so this year no, because this virus, even the flu virus, changes from year to year, and we feel that this may happen. This may be the same as well with this COVID 19. And we can only be rest assured when we develop some vaccines. That's when we can be rest assured. And once again, we don't know how long even these vaccines can protect someone. Okay, so yeah, having the COVID twice, I've explained to us how that can happen. You can have the symptoms, you can have the virus without symptoms, you can have the mild symptoms, get better, become unwell, and you get tested and you still show positive. And obviously, there are various tests, the antigen, which means the virus, then looking for the antibodies. I'll have some of my staff that went for testing. The antibodies, they were negative, and a couple were had the antibodies positive as well. So yeah, this is just, we have to be very careful on saying yes or no, and I hope I've not confused anyone, please. And if, for instance, there's an area, what I've spoken about, what I've talked, that you are not sure of, please do get back to me. There have been areas like in China, in some other areas, where people tested positive, got better, and after a while tested positive again. It depends on your immune response, on how protected you are, how you develop the immune response after the first infection. Okay, and we don't know how long these antibodies you develop after the infections can protect someone. The virus is still trending. We're still learning a lot about it. Okay, and so yeah, once again, what to do is to prevent. Prevention is always better than cure. Take care of yourselves. Maintain your social distancing. Wash your hands with soap and water. Keep safe and play safe. God bless. Bye.